Today we will start off with a really cool presentation, and we're really lucky to have. We'll make sure make sure this is right, Gil. Dr. Gil Alterovitz, right, MD, VA Chief AI Officer of the VA. Director of National Artificial Intelligence Institute, U.S. Department of Veterans Affairs. And so, number one, VA has done some wonderful presentations for us in the past, and we're really lucky to have Gil with us today. We'll be talking today about developing strategies for AI governance, the VA, and beyond. So the mic is yours.
Great. Thanks, everyone, for coming to what I guess is the last day of this great conference. And I've seen a number of the talks that have taken place in the prior days, and I think that it's a good background for some of the work going on. You heard about AI and some items related to trustworthy AI a couple days ago. A few items related to health equity, and today I'll kind of show you an example of how we're looking at doing this in the Department of Veterans Affairs, and how we're looking to take this forward in practical steps at what turns out to be the largest integrated healthcare system in the United States, which is the VA. So if we go to the next slide here, let's take a look. Okay, so I'll give you a little bit of an overview of artificial intelligence at the VA. Talk a little bit about governance and trustworthy AI, and kind of explain how they're kind of interlinked in some ways. Then we'll do a use case for approval, looking at trustworthy AI in the field, and by field we mean like at a medical center as opposed to like in a cubicle or an office, in Washington here. And then looking at trustworthy AI at the VA and beyond. We've seen other agencies leverage and take advantage of some of the work that we've done moving forward. Okay, so first, AI at VA. So we have, at the VA, there's over 9 million patients in the medical records, and currently it uses the same medical record system. It's a system that was written Vista for the VA specifically, a custom type of software, essentially. What's interesting is that not only then does it have the information about all those patients, right? We're essentially both a provider and a payer. We have both their medical record information, also, right? We pay for those services essentially as well. I think that's, and having all those medical centers, all that's kind of what makes it also the largest civilian agency in the U.S. We have many clinicians, and what's interesting is that a majority of U.S. doctors and nurses at some point are at the VA. It may be during their training, maybe an internship, a fellowship, but at some point. And so it's a great opportunity to leverage any of the kinds of work that we do and make sure and see it going around and getting out to the systems, as well as learning from other systems out there. There's also a strong research program at the VA. There's one example is the Million Veteran Program, and we're getting really close to that millionth genomic donation, and which is linked to medical record data and other types of information, and making it the largest genomic database that is linked to medical records. There's also a lot of other types of data, 10 billion images, about 1 billion images a year that get added. So an increasing number of images and so forth. A lot of medical facilities, a lot of facilities in general. I mean, you may not be aware, but the VA has facilities everywhere from the Caribbean to the Philippines, to Guam. Like, it's in many different locations, and of course in each state, and multiple ones and so forth. So a lot of possibilities there. And why I mention this is because data is really a key part of AI. If you kind of think about it in a simplistic way, an AI model is essentially, in a simplistic way, compressed data, right? And so the more data you have, the better models you can develop, the more accuracy you can have. And there are many studies also that show that having more data can lead to better results than having a more complicated model with less data. And so, there's a lot of possibilities here for our mission. The National Artificial Intelligence Institute was just started just a couple years ago, 2019, and really is seeking to bring together research, implementation, policy, and collaboration to enhance the outcomes for our veterans using artificial intelligence in different ways. So I'll tell you a little bit about that. In terms of choosing the different AI work, we get a lot of inputs from everyone from veterans to advisory board to medical centers, an AI at VA community, an AI task force, which was relatively recently upgraded to an AI working group for governance. And then we look at the feasibility of the different types of use cases and then seek to focus based on that. One of the things that we've done is work toward building an AI network. There are currently 4 of these at different medical centers. So you can see Washington, D.C., and that one refers to the actual medical center in Washington, D.C., not the headquarters that's by the White House. And all these other ones are also the medical centers. And what that allows us to do is whenever we do either research or piloting, we can iterate, we can scale and try it in different locations and learn from that. It also gives us a diversity of talent and a diversity of patient populations. So you may have seen during COVID when there were different waves, different geographical regions were affected differently. So if you had a model that was kind of an average of everything, it may not be as accurate as if you build on certain regions, but certain regions might not have enough information, so you might want to leverage some of that national information, right? And so having this kind of network allows you to do that. And our AI network is growing, in fact. Now, as you see, there are 4. And so what that allows us to do is really take advantage of the different data, build that data science expertise, that clinical and healthcare expertise so people can really work together and enable diverse populations and the geographics to play a role and to make sure that we look at all those variables and avoid biases. So in addition to the medical centers, one thing that's interesting at the VA is that we have these affiliates that are at universities. So often the medical center will have a university nearby that they work with. And so working with those academic affiliates is also a strength of this network. And we do also seek to, in some cases, have collaborations with external partners as well. And recently we've been developing this network and governance structures in collaboration with a data governance council. And I'll talk about that a little bit, as well as working on R&D with an eye toward piloting. So here's a few of the use cases. There's over 100 use cases. We have them on our webpage, which I'll include at the end. But here's a few that kind of, just give you a few examples. One, around improving access to healthcare. We'll go over a couple examples in a little bit. Human resources. One of the challenges sometimes in government is to hire quickly, hire efficiently. And so anything that helps in that process, whether it be getting more information about policies, standardization, position descriptions, can help make that faster. And then this idea of healthcare worker burnout, which is the last one. So can we leverage things like clinical reminders, ambient dictation of visits, so when kind of capture that conversation, that dialogue between the patient and the provider in a way that it makes the notes easier to save into the medical record. And then the VA has these medical centers, but the veterans also have an ability to go out to the community to get care outside of the VA and then come back to the VA. So it's not a completely closed system necessarily. When that happens, and we often get these PDFs basically that kind of look like images essentially to within the VA. And so artificial intelligence can be used to translate that into structured information that can be used to then look at kind of next point in what the action plan might be and capture that SOAP note in a way that you can move forward. we'll talk about that, but the last two with a star, we just announced an AI tech sprint for that as part of a new AI executive order that came out October 30th. How many people have heard of that artificial intelligence executive order? Came out. Okay, well, I'll talk about it a little bit later, so we'll get to that then. Just to show a couple another example of where it's not only in actually provider-patient interactions, but there's a lot of places in kind of operational efficiency where you can move things forward. So, for example, the NIDE Digital Command Center kind of gives you almost like a mission control view of, and that allows you to really understand how bed space, operational efficiency, staffing, how all of that is going on in one picture. And then it also has modules for AI to be able to find patterns and be able to kind of give you new insights on that. And this kind of work has been going on a couple universities also in the area, and we've been trying that work, and it's being used live now as well. And then the other thing I want to talk about, and this is something that I think we see across organizations, is the issues around workforce, right? Like everyone wants to do AI, right? But it's hard to find people, it's easy to find people who say they know AI, but it's hard to find people who really do know AI, is I guess the way to put it, right? And so, or at least AI for what you need, right? Because AI and how it applies could be very different for specific applications where you might need health expertise and AI expertise, or you might need a specific development expertise. And so we've been trying a couple of multi-pronged approaches that I wanted to share here. One of them is this Aspire program, All Services Personnel and Institutional Readiness Engine. Some of you may have heard it was called Teams before, but turns out Teams is an acronym that's used too often. And so we rebranded it, and then we found that there's someone else who has Aspire too. No, but actually there is another Aspire, but it's a different project. So, but we're going to keep this name. And but what I wanted to really mention here is that this is an inter-agency type of work. You can see the logos of some of those agencies down there. And they're not, some of them are in the military ones, some of them are not. So when it says personnel, it just means kind of staff in general. And the idea is that we have personnel, right? But some of them maybe through education, through new skills, can develop some type of AI skills and knowledge that'll allow them to do their job better. And that could be used in addition to trying to recruit others that may have specialized skills. And so what this one does is it actually uses AI in kind of a meta way to analyze where the person is and make a customized plan for how they could get to a certain type of job that you might want them to do. And it can be used for people you have. It could also be used for people you're looking to hire that maybe they almost meet all your criteria, but there's one or two things that they might need to develop to be able to do the type of work that you want them to do. So you can make that custom plan and see if that can work for them. And so there's a lot around AI training. We've seen congressional bills, executive orders, and so forth. This is certainly one approach, and of course, we're looking at other ways also of increasing recruitment, different types of fellowships and other programs, including some of the ones in those executive orders that we leverage. I mean, I started in one of those. It was called the White House Presidential Innovation Fellows Program, and we're looking to recruit others through specialized programs like that with the hope that those people then stay in government. About 50% do in some of these programs. So those are some of the approaches we're thinking of, and I think all of these could have analogs in hospital or industry systems. In fact, we've seen some these kinds of fellowship programs and so forth starting up outside of government as well. So just wanted to bring that to people's attention. And now we'll go into governance and trustworthy AI. So that's kind of the next section here. That's how we're doing on time. We're okay. So at least in the federal space, there are a number of drivers of trustworthy AI activities. And this is one of those slides where it's not meant for you to kind of read each line, but just see there are a lot of lines, right? And rather than going through each one, the main point is that there are a lot of these different approaches which complement each other and are synergistic. And so when we are thinking, how does that apply to us at the VA? We are thinking about how can we combine these together in a way that works for our veterans, right? And it integrates our mission, right? And so that's kind of what this slide is about. There are a lot of these, and we worked in a way to create a framework that integrated these as well as information for veterans so that we have our trustworthy AI framework for the VA, which I'll talk about in a little bit. But there are a lot of efforts going on right now around national AI strategy. There's a lot of discussions getting input from the American public. There are a number of new initiatives, a national AI R&D strategy also that was released in May. So there's a lot of work in this area. So what we've tried to do is both develop an overall VA AI strategy, right? So that's not only trustworthy AI, that's one of the pillars, but an overall strategy of how we would, for example, develop AI capacity, how we would increase our workforce, those kind of things. And there's a link there to that. And then we've also been working on a VA trustworthy AI framework, which is kind of like one of those pillars kind of expanded, right? And that framework is what I'll talk about in a little bit here. The good news is it was approved agency-wide July 2023, and it was announced by the secretary at our conference, our International AI Summit that took place in September. And you can actually get a copy of it either by that URL or I think just typing in the title of the document could also work out there. And so what I want to show you now is an example of going through and how we're starting to leverage that trustworthy AI framework that has different elements that we go through whenever we look at a use case in AI. So for example, there are essentially there's different pathways that different use cases go through. So if you're doing research and development, then you go through this institutional review board, and that's one approach. Or if you go and you're doing something operationally that is being used on, then you would go through an AI oversight committee because it's kind of non-research, so it has different criteria. And so we did do I guess you'd call it a pilot with one of our AI network centers initially. Now it's expanding to the other AI network centers. But in that one, what it was interesting was we actually found an industry-sponsored research proposal that at our site where we have these questions that we ask, it was found that there was an issue around transparency, right? And so they kind of went back and kind of reworked that. But at another non-pilot site, they weren't able to see that, right? And so we were able to show that this really can make a difference. And what we found is that one of the key things is just knowing what questions to ask, right? So we don't mandate that there's a new institutional review board process. Rather, we have this module that is a list of questions that gets people thinking about what are the questions to ask, so then they can work with the vendors or whoever it is to ensure that these trustworthy AI framework principles move forward. As I mentioned now, it is a kind of moving and being piloted at these 4 sites. We've also been looking at this idea of model cards. How many people have heard of model cards? I may have been talking about one of the other sessions, a couple of people. So the idea in model cards is that think about, I don't know if someone has like a Coke bottle or about, if you look on the side, it has kind of how many sugars are there, carbohydrates, kind of that nutrition label. Think about it like that, like kind of translating something that you don't know. I mean, unless you do a mass spec analysis, you don't know what chemicals are in your beverage, right? And the same thing with AI, like unless you actually look at the code and so forth, you won't know, right? But if you can have like a little summary of how it works, what are kind of data it uses, accuracy, metrics like that, performance metrics, then it can give you an idea about it. And if, and that could be helpful for some people like providers. And then for patients, they might want to know how it uses their data, what it means, things like that. And so That's what a model card is. So we're looking at that, and we find it's quite different what you would give a patient versus a staff member, a provider, or so forth. At least in terms of what they're looking for in there. And then, like I said, the other one is the AI oversight subcommittee. So as mentioned, right, if it's not research, it goes to that one. And that also includes if you have AI contracts or procured biomedical devices. So, for example, we have this device used for colonoscopies, and where it essentially uses augmented reality to label where a potential polyp is, right, using AI there. And, it's being used, and that was a device, right, so it kind of has a different pathway there to get evaluated. So this kind of brings them together, right, in that these things are all kind of interlinked. Model cards are helpful both for understanding and taking forward some of the AI oversight committees. It intersects with research so that they give informed consent about something they actually, they know how it's being used and so forth. And so these are the three elements that we've been looking at for the field. And now I'll talk a little bit in the last couple minutes about trustworthy AI at the VA and beyond. Let's go. So this is our trustworthy AI framework. These variables we constructed by looking, remember that long list? I was like, here's just a list of different approaches that are out there. This integrates all of that together. And these principles, then we have these basically questions, and we have standard kind of SOPs to then carry forward and make sure that we evaluate whether or not it's trustworthy in these different aspects. So, there's a quick start guide. These are some things that if people are interested, let me know. We found other agencies have found some of these useful, so that way that the use case owners have clear guidance on how to approach and make sure that their work has trustworthy AI. So let's see. I know we're running low on time, so I may go through some of that. But just say that what this framework does is it really unifies and in some ways disambiguates all the multiple federal requirements by putting it together into one framework that really works for the VA. It provides a foundation for actionable and measurable implementation guidance through those SOPs that I mentioned. And it also aligns to the needs and timing of multiple, now released White House initiatives that just came out around October 30th and a couple days afterwards through an executive order, as well as this memo from the Executive Office of the President, Office of Management and Budget. So we've been working across agencies on this. Just to say, this is the executive order, really is about spurring innovation, and at the same time making sure that we do AI in a responsible way. It names AI to do a number of things there, including running an AI tech sprint, which we're going to do around healthcare worker burnout. There's $1 million in prizes there. If people are interested, you can find it on challenge.gov and apply there. And then there's a few other things in the executive order that we'll be working with other agencies like DOD and HHS on some commonality. So in conclusion, we've been working both on research, development, and implementation, focused on making sure that we enable trustworthy AI. We've got a number of oversight and approval processes, both centrally as well as in the field, that is, in the network, in the medical centers and so forth, and looking across regions. And our trustworthy AI initiatives at the VA really help to unify a number of these standards, and so that we can kind of take specific, actionable, and measurable implementation. And I'll end with, that's kind of a link to our department AI website, and from there you can kind of link and go to our strategy, our trustworthy AI framework, and all the other things. So with that, I will end and see if we have any time for questions. I'll pass it back to Michael, I think. Yeah, there we go, yeah.
Thank you. We have one question virtually. One of my veteran friends has told me that for certain special care, he has gone to a non-VA practitioner or facility. When this occurs, is that episode captured and included in your database so that a more complete treatment picture is recorded?
Well, that is a great question because it actually relates to our AI tech sprint. So we have two tracks. One of them is this ambient voice dictation, and the other one is specifically dealing with how do we get and process those notes and information that come from the community, right? So how we get them now is I don't know how many people have used a fax machine recently, but there are faxes that from the community that we'll get them as a fax or something like that, which to us then looks like an image, right? And if you want to change that image into something that is AI ready, AI-able data, then you need to use optical character recognition. You need to structure, summarize that information in some way, and so that is the second track of our AI tech sprint, which is basically taking image, we're looking for solutions that take what looks like an image and then converting into something that can go into the medical record that makes it much easier for the physician to search through and find their information rather than manually having to look to like 100 pages of images. So great question, and yeah, check out challenge.gov for that. We're looking for different approaches as part of that competition. We have another.
We have a question here on the floor.
Just want to say, it's not a question, it's just want to say thank you. Veterans Day is observed tomorrow. Officially, November 11th is Veterans Day. But the VA takes very good care of our veterans. And so just want to say thank you for everything you do. You and team keep up the AI work. And just know you've got a whole team right behind you. Thank you.
Thank you very much. Appreciate that, and I'll relay that back to the team. There's a lot of people that are working on this work, and we're glad to be that there's that recognition there.
Hi, I was just wondering if part of all of the work that you're doing in the plan, do you have an ability within that to measure sort of with the AI in the different areas that you're adding efficiency, making improvements in, whether it's the tech delivery or the clinical care, that aspect?
Right. So, and was that specifically for the strategy or for the trustworthy AI analysis of the use cases?
I think probably in both. Is it part of your strategy overall to look for that outcome and then?
Yeah. So for the strategy, and I think you can get to it from that page. Like there's a place where it has like different metrics that we can use to quantitate success, right? And then for the trustworthy AI framework, the metric we're using is consistency or inconsistency as defined by Executive Order 13960 as well as 14110, which basically means that it follows it follows all of the principles in a way that is accepted by our AI working group. And so we analyzed over 100 cases looking at each of those criteria, first kind of essentially like getting information to use to make that judgment and then make that judgment. And for things that are inconsistent, then we create a consistency plan for them so that they have time to make it consistent. The way the executive orders work is that if things are found inconsistent and they're not made consistent after a certain amount of time, they may potentially be shut down. But the goal is to make everything consistent or retire something that's not being needed or used or something like that.
Dr. Alterovitz from the VA, thank you very much.